Good day, my name is Ryan Sangila. So today we are here to discuss about our case presentation of patient with liver cancer stage 4 or also known as hepatocellular carcinoma. So today under this we have the context. Firstly, we are going to discuss about the objectives, introduction, definition of terms, vital info, present and past history, Gordon's assessment, the PEROS, laboratory and diagnostic test, normal anatomy and the physiology, concept map that includes the pathophysio, drug study, nursing care plan, medical and surgical management, health education plan, and lastly the discharge plan and also the prognosis. Starting with the objectives, we have the general objectives. At the end of the case presentation, the student nurses will be able to develop and acquire complete knowledge and management of a patient with a liver cancer stage 4 or hepatocellular carcinoma. For specific objectives, at the end of the case presentation, the student nurses will be able to, within the allotted 1 hour, 1.5 hour, the student nurses will be able to present hepatocellular carcinoma that will give the co-student nurses clarification about the topic and evaluation from the clinical instructors, and identify the medical terms related to this condition, analyze the vital information and clinical features of the patient with HCC, determine the Gordon's assessment of the functions health pattern, and proactively present a thorough general assessment of the patient, which includes the physical assessment and the family history taking, evaluate the diagnostic tests needed, understanding the anatomy and physiology of the involved system of HCC, analyze the factors associated with the development of this condition, and discussing and understanding the pathophysiology along with its etiology of the patient's condition. We're also going to explain and share the most prioritized nursing diagnosis and emphasizing the disease progression through the concept mapping, formulating a nursing care plans for the problems identified, and lastly, responding to the following queries and questions posed by our clinical instructors and to our fellow student nurses. So, the introduction. Hepatocellular carcinoma. So, what is HCC or hepatocellular carcinoma? It is known as the most common term or most common form of liver cancer, arising from the hepatocytes, the main type of liver cells. It typically develops in the settings of chronic liver disease such as the cirrhosis, hepatitis B or C infections, or non-alcoholic fatty liver disease, or also known for the shorter term NAFLD. Hepatocellular carcinoma also presents with non-specific symptoms in the early stages, which includes the abdominal pain, weight loss, fatigue, and jaundice, which our patient has. All of this explained through this. Increasingly, people diagnosed with HCC have liver condition that sometimes leads to the cirrhosis, called the metabolic dysfunction associated steatotic liver disease or MASLD. In the beginning, HCC grows slowly, and one of the ways to remove HCC is surgery to remove the tumor or liver transplant that can treat HCC in the early stages. Some have a condition that can lead to cirrhosis of the liver. In some instances, usually the most individual who will get these illnesses is usually male genders, male, specifically who are alcoholic and smokes a lot of cigarettes in their early stages of being an elder person. This condition never progresses to cirrhosis, but people still develop HCC with conditions such as unmanaged long-term liver inflammation can lead to severe scarring and eventually to this cancer. The latest estimates from World Health Organization states that the liver disease caused approximately 2 million deaths in 2019, And the liver cirrhosis and liver cancer are currently the 11th and 24th leading causes of death worldwide, respectively. Around 354 million people globally lives with hepatitis B or hepatitis C infections. Here in the Philippines, a lower middle income country, accurate statistics on the burden of the liver disease are lacking due to the lack of wide-scale epidemiological studies. So according to the Philippine Statistic Authority, those who have liver diseases accounted for 27.3 cases per 1,000 deaths in the country back in 2020, which is one of the earliest recent cases in our country. Liver cirrhosis accounts for 31.8% of liver-related deaths in the country, while the malignant disease of the liver comprises 35.8%. With another is we have the viral hepatitis comprises with 5.3% of the liver-related deaths. The Philippines logged a total of 10,594 new cases and 9,953 deaths in 2020, with a 5-year prevalence in all ages at 2.01 per 100,000 population. So the calculated incidence rate for liver cancer in the country is 11.4, and the mortality rate of 10.8 per 100,000 of population. The most common cause of HCC in the country is still chronic hepatitis B infection.
So good day everyone, my name is Cassandra Festo Valdon and I am going to discuss the definition of term. So first is the creatinine. So it is a substance derived from creatine and creatine phosphate in muscle. So creatinine is excreted in the urine. Next is diabetes mellitus. So DM or diabetes mellitus is a metabolic disease involving inappropriately elevated blood glucose levels. Third one is hepatocellular carcinoma. It is an aggressive, fast-growing cancer, most common in people with advanced liver disease like cirrhosis of the liver. So next is the hepatitis. Hepatitis is the inflammation of the liver. So the liver is a vital organ that processes nutrients, filters the blood, and fights infections. So when the liver is inflamed or damaged, its function can be affected. So heavy alcohol use, toxins, some medication, and certain medical condition can cause hepatitis. Next is the hepatic encephalopathy. So it is a decline in brain function that occurs as a result of severe liver disease. So in this condition, your liver can't adequately remove toxins from your blood. So next is hemoglobin. Hemoglobin is a protein containing red blood cells that is responsible for the delivery of oxygen to the tissues. Hematocrit measures the volume of blood that is made up of red blood cells and it is expressed as percentage. Hypertension. So hypertension is an elevation of the arterial blood pressure above the normal range expected in a particular group. So next is immunotherapy. So it is a treatment that uses a person's own immune system to fight cancer. So immunotherapy can boost or change how the immune system works so it can find and attack liver cells. Next is liver cirrhosis. It is a type of liver damage where healthy cells are replaced by scar tissue. And next is liver cancer. Liver cancer is a malignant tumor that begins in the liver. Metabolic dysfunction associated steatotic liver disease or the MASLD. So it is a condition where there is a buildup of fat in the liver in people with diabetes, obesity, high blood pressure or high cholesterol, and drinking little to no alcohol. So next is the non-alcoholic fatty liver disease or the NAFLD. So it is conditions characterized by the accumulation of fat in the liver, which can progress to inflammation and fibrosis. So advanced stages, especially cirrhosis, are associated with increased risk of HCC or the hepatocellular carcinoma. So next is pallor. So pallor is an abnormal paleness of the skin due to reduced blood flow or lack of normal pigments. And last is surgical resection. So surgical resection is a procedure which part or all of a certain tissue or an organ is removed. So an organ or tissue may need to be removed for various reasons like disease, damage, or trauma.
Hi everyone, I'm Lovely Villian. Today I will be discuss about vital information. Name, patient S, age 69 years old, gender male, civil status married, date of birth June 29, 1954, place of birth Iligan City, cultural group Cebuano, nationality Filipino, primary language Cebuanong Bisaya, religion Roman Catholic, highest education attainment not married, occupation jeepney driver, reason for health contact liver cancer, fever and abdominal pain.
Present and past history. History of recent illness. 1 day prior to admission, the patient experienced the sudden onset of severe right upper quadrant pain, described as a 7 out of 10 on a pain scale, with a squeezing sensations that extended to the epigastric area. Despite the administration of tramadol on 2 occasions, there was no significant elevation of symptoms, which were further compounded by sweating and general sense of malaise. The following morning, the symptoms persisted, now accompanied by the onset of fever, prompting the patient to take paracetamol, which provided some relief. Approximately 2 hours prior to admission, the patient noted the development of shortness of breath, which persisted alongside ongoing right upper quadrant pain, ultimately leading to the decision to seek medical consultation and subsequent admissions for further evaluation and management. History of past illness. It was noted that they were diagnosed with liver cancer in 2016, Cagayan de Oro, followed by the onset of diabetes mellitus 2017, for which they exhibited compliance with vildagliptin 50 mg and glimepiride 2 mg medications. Furthermore, in November 2023, also in Cagayan de Oro, they underwent transarterial chemoembolization or TACE as a part of their treatment journey. Psychological history. Tobacco use. The patient smoked 3 packs a day. Alcohol use. The patient stopped drinking. Drug use. None.
So good morning everyone, I am Emerine Belisco and today I am going to discuss the Gordon's assessment. So for the functional health pattern assessment, under it is the health perception and health management pattern. So before hospitalization, the 60-year-old patient who has been experiencing abdominal pain for the past 5 days has been admitted to the hospital, and the admission was prompted by a sudden onset of stomach pain, which he described as sakit akong tiyan prior to admission. And initial vital signs were taken and recorded as follows. So for the temperature 36.9, BP 20/60, HR 95, RR 26, and Autosat is 97%. And then during hospitalization, the patient is on bed, sleeping, and as observed, cannot really move. And for the latest vital signs were taken and recorded as follows. So for the temperature 37.5, BP 110/60, HR 95, RR 23, and Autosat 99%. And then for the nutritional and metabolic pattern, the patient consumes a typical meal on a daily basis. However, dietary restrictions are necessary due to cultural differences and diabetic. These restrictions encompasses specific food choices that are made to accommodate cultural preferences and follow a dietary restriction for managing diabetes effectively. And the patient reports that sometimes he has difficulty swallowing food. Additionally, the patient presents with dental problems and consumes 8 or more glasses of water daily. And during hospitalization, the patient had gradually lost some weight, weighing from 75 kg to 55 kg due to his illness. And the patient still experiences difficulty swallowing. Next is elimination pattern. So before hospitalization, the patient reported defecating once a day, occasionally experiencing difficulty with bowel movements. And additionally, the patient occasionally experiences constipation and frequent urination at night. And during hospitalization, the patient reported having 1 to 2 bowel movements per day. And next is exercise and activity pattern. So before hospitalization, the patient engages in light exercises such as walking and feeding chickens occasionally as one of his hobbies. The patient experiences pain in the arms, legs, and back. And additionally, the patient gets tired easily and reports of feelings of fatigue, lightheadedness, and palpitations. And the patient admits to smoking and consumes approximately 3 packs a day. And during hospitalization, the patient spends most of his time in bed, engaging in activities such as watching TV, sleeping, and conversing with his wife and daughters. And latest vital signs were taken and recorded as follows. So the temperature 37.5, BP 110/60, HR 95, RR 23, and O2-SAT is 99%. Next is sleep and rest pattern. So the patient is experiencing difficulty sleeping and may remain awake for up to 2 consecutive days as reported by the patient. And additionally, the patient rarely experiences nightmares. So during hospitalization, the patient remains in bed for the majority of hospitalizations, engaging in activities such as watching television, sleeping, and conversing with their partner and daughters. Next is personal habits. The patient stopped drinking alcohol ever since he discovered that he has not been feeling well and tries to avoid smoking due to his current status. And during hospitalization, the patient has been drinking only water. Next is cognitive and perceptual pattern. Before hospitalization, the patient has been diagnosed with cataracts and has undergone eye examinations, necessitating the use of glasses. And blurring of vision experienced by the patient has resulted in headaches. And during hospitalization, the patient continues to experience blurred vision leading to headaches. Next is self-perception and self-concept pattern. Before hospitalization, the patient is experiencing anxiety and occasionally engages in overthinking regarding his current situation. And during his hospitalization, the patient continues to experience anxiety and occasionally engages in overthinking due to his current situation. For the role relationship pattern, before hospitalization, the patient mentioned he is living together with his wife, daughter, and his grandchild, and additionally explained that they have a great relationship and supportive care towards him. And during hospitalization, the patient is accompanied by his wife and daughters, who serve as a vital source of supportive care. Next is sexuality and reproduction pattern. So for the before hospitalization, the assessment was not assessed due to the patient's discomfort with the procedure. And Same with the during hospitalization, the assessment was not assessed due to the patient's discomfort with the procedure. So next is coping stress management patterns. So the patient before hospitalization, the patient exhibits anxiety regarding his situation, as reported by the SO. And this anxiety prompts the patient to engage in distraction techniques, such as feeding his chickens. And additionally, the SO notes that the patient finds solace in prayer and listening to worship songs as coping mechanisms during times of stress. And during hospitalization, the patient remains in bed for the majority of his hospitalization, engaging in activities such as watching television, sleeping, and conversing with their partner and daughters. And lastly, values and belief pattern. So the significant others reports that the patient has been faithful to God and consistently prays for good health, believing that prayer is one of his healing practices and that he surrenders himself in worship to God. And then during hospitalization, the significant others reports that the patient has been devout in their faith and consistently praying for good health before and during his stays at the hospital. And the patient has found meditation to be helpful in managing their well-being.
So, morning guys. Today we're going to talk about the physical examination and review system for the patient. So good morning guys. Today we're going to talk about the physical examination and review system for the patient. So, for the areas assessed, general health survey, our subjective findings, sakit akong tiyan as verbalized by the patient. And for the objective findings, received patient awake, lying on bed, coherent to time and place, not in distress, with ongoing nebulization pod, negative displeasing attitude towards the healthcare workers, cooperative, and dili pod irritable ang patient, and positive siya sa discomfort. So the patient weighs 36 kg, so gamay-gamay na patient, no? The patient's vital signs data: temperature 37.5, BP is 110/60 mmHg, heart rate 95, RR 23 beats per minute, and autosat is 99%. So among problem identified ani is alteration in comfort. For the integumentary system, no, subjective is negative siya sa skin rashes, and negative siya sa excessive itching. So for the objective, skin is warm to touch, senile skin turgor, and positive siya sa jaundice, and positive siya sa pale and also dry lips. So the problem identified ani is risk for impaired skin integrity. So now for the hidden face, eyes, ears, nose, oral cavity. Sa subjective is hidden face, sakit akong ulo as verbalized by the patient. For the eyes, negative sa contact lens, nagwear siya og glasses, blurry visions, and negative siya sa usage of eye medication. So we asked the patient, when was your last eye examinations? Mga 2016 siya last nagpa-check up sa mata as verbalized by the significant other. For the ears, no hearing problems, and we asked also, do you listen to loud music? So dili siya naka-listen sa loud music. For the nose, it has the ability to distinguish different sounds, and the use inhaler for nebulization. The patient is using ongoing nebulization while nag-interview me. For the oral cavity, he has 5 tooth decays. For the objective sa head and face, wala na assess. For the eyes, positive sa anecteric sclerae, pale conjunctiva, and also cataract. For the ears, both ears are symmetrical, normal in size, symmetrically on either side of the head. For the nose, no nasal discharge and also no nasal flaring. And for the oral cavity, like itong ganina, tooth decays and dry lips. For ang problem identified naman is impaired comfort or kay naman siya headache. So next area assessed was neck. So do you experience stiff neck? So maka-experience siya stiff neck as verbalized by the significant others. For the palpation we did not assess. And objective, positive siya sa stiff neck and negative sa neck masses. So our problem identified is impaired mobility. So next, for the respiratory system, our subjective is wala siya asthma as verbalized by the significant other. Do you ever have trouble breathing? Wala sad. Negative sa wheezing, and positive siya sa exposed to air pollutants, smoke areas. For the objective, so equal chest expansion, clear breath sounds, negative retractions. Yung RR is 23 beats per minute and O2 is 99%. So we have no problem identified. So next area assessed is the cardiovascular system. So subjective cues, murag kusnoton as verbalized by the significant other, and objective is a dynamic pericardium, PMI at 5th ICS LMCL, and hazy and streaky densities are seen in right lower lobe, and aorta is tortuous calcified. And for the problems identified, are atherosclerosis aorta and right lower lobe pneumonia. So next areas assessed is breast and axilla. So no data provided and no problem identified. So for the gastrointestinal system and the abdomen, subjective is sakit yan tiyan tungod kina siya bukol yan tiyan as verbalized by the significant others. So for the objective cues, abdominal pain, positive siya sa direct tenderness over the right upper quadrant radiating to the epigastric area, and negative sa Karnofsky performance status. Also, yung abdomen is flat and soft. And for the problems identified is abdominal pain. So next, for the genitourinary or the reproductive system, subjective is bladder control, palpation did not assess, percussion did not assess. For the inspection, or negative sa dysuria and anuria, and negative po sa hematuria. So the problem identified is wala. So next, for the musculoskeletal system, subjective is do you have any back problems? So way sakit sa muscle ug sa mga buto as verbalized by the significant other. So for the objective, negative muscle pain and negative sa joint pain, and no problem identified. For the neurologic system, kailangan og assist para mobaklay as verbalized by the significant other. So for the objective is conscious and unable to stand or walk alone. So our problems identified, impaired gait and balance. So next is for our lymphatic and hematologic system. So no subjective data are provided. So for the objective data, paleness, negative sa paleness, negative sa flushed skin, and negative sa bleeding. And ang yung hemoglobin is 51.0, yung hematocrit 0.5, which is abnormal sad. For our problem identified is an effective tissue perfusion. So lastly, for our endocrine system, ang among subjective is we asked how is your tolerance to heat and cold temperature. Ang siya sakto lang ang yang ma-feel sa kabugna ug sa kainit as verbalized by the significant other. So we also asked, do you notice any drastic changes in your weight? Ang iyang timbang ay 78 to 50 gikan pagsakit as verbalized by the significant other. So ang among objective findings ani kay negative siya sa wound. Yang SGOT or AST is 114.1. Ang yang albumin test is 29.88, which is abnormal. So So we concluded that problems identified is liver damage. So that's also PEROS or the physical examinations and review of system.
So next is the laboratory and diagnostic results. So first kay ang red blood cells or iyang RBC. So ang result is 1.66 and ang normal value sa RBC is 5.2 to 5.4. So below normal level siya ang sa patient. So for the hematocrit, ang result is 0.15 and ang normal value is 0.42 to 0.52. So below normal level siya po ang sa patient. And next is sa hemoglobin. Ang result is 51.0 and ang normal value is 135 to 180. So below normal level siya po sa patient. And below normal level of red blood cells, hematocrit, and hemoglobin are indicative of anemia, dehydration, and kidney problem. So next is ang white blood cells. So ang white blood cells result sa patient is 15.33 and ang normal value is 4.0 to 10.5. So above normal level ang sa patient. And ang elevated WBC or white blood cell counts can be a sign of underlying infections. So for the differential count, so ang segmenters is ang result iya kay 0.89 and ang normal value is 0.35 to 0.66. So above ni siya guys. So above normal level ang patient, and sa iyang lymphocytes ang result is 0.06 and ang normal value is 0.24 to 0.44. So ang sa patient is below normal level. So ang above normal level nga segmenters and below normal level of lymphocytes kay kini siya sign maybe a signs of or indicative of kanang ma-inflammation and infections. So next kay ang SGOT or SGOT-AST or the serum glutamate oxaloacetate transaminase. AST is aspartate aminotransferase. So ang sa patient kay ang result kay 222.2 while ang normal value is 8 to 37. So taas kaayo ang sa patient. Ang result sa iyang SGOT-AST and sa iyang SGOT-ALT or the serum glutamate oxaloacetate transaminase. Ang iyang meaning sa result sa patient kay 114.1 and ang normal value kay 5 to 41. So again, taas ra gyapon kaayo ang result sa patient. So elevated levels of SGOT-AST and SGOT-ALT in patients with liver disease are significant indicators of liver injury or damage. So next kay ang creatinine. So ang sa patient ang result sa iya is 126.23 and ang normal value sa creatinine is 62 to 120. So above normal ang iya ang creatinine. So, elevated creatinine levels in blood may indicate impaired kidney function. So, sa hemoglobin test, so ang result is 208 and ang normal value is 70 to 100. So, above normal gyapon ang sa patient. So, ang above normal value of hemoglobin test, so meaning ana kay taas ang blood sugar level sa patient. So sa albumin, is ang result is 29.88 and ang normal value niya is 38 to 54. So sa patient is below normal value and below normal levels of albumin in individuals with liver cancer and diabetes mellitus indicates significant liver dysfunction, potentially leading to complications such as fluid accumulation, impaired wound healing, and increased susceptibility to infections. So, ang sodium, for the sodium is, ang result is 128.7 and ang normal value is 135 to 148. So, below normal ang iyang sodium. So, for the stool, sa stool analysis, so, ang color sa iyang stool is tarry and ang iyang consistency kay soft and naay blood sa iyang stool. So, a presence of blood in the stool may indicate risk for bleeding.
So, good morning teachers, good morning classmates. I'm Sunit Nars, underground called C. Barcenas, and I will be talking about the normal anatomy and physiology of the liver. So, the liver is the largest gland in the body. The liver is found inferior to the diaphragm and occupies the majority of the right upper quadrant, or RUQ, of the abdomen. It serves as both as exocrine organ and the endocrine organ. Let's talk about the exocrine and the endocrine organ. The exocrine functionality of the liver is mainly in the synthesis and excretion of bile salts into the common hepatic duct, as well as the conjugation of bilirubin and excretion of the gut. While the endocrine functions of the liver include involvement of the glycemic control via insulin and glycocagon. The liver synthesizes important proteins such as fibrinogen, albumin, protothrombin, and other amino acids, as well as modifies proteins into enzymes and the peptide hormones. Its digestive function is to produce bile. It is the yellow to green watery solution containing bile salts, bile pigments, bilirubin, a breakdown product of hemoglobin, cholesterol, phospholipids, and electrolytes. Anatomically, the liver is viewed as having four main lobes. There are smaller left lobe and a larger right lobe that are separated along attachment of the falciform ligament, as well as caudate and quadrate lobe, which are part of the anatomical right lobe. The quadrate, located at the inferior side of the right lobe, separating the aqueduct and the quadrate lobes is a deep transverse fissure called porta hepatic, which transmits all vessels, nerves, and ducts entering or leaving the liver. As you can see in the given picture, the legend shows that the yellow is the left smaller lobe, and the brown one is the right bigger lobe, and the blue one is the caudate, and the green one is the quadrate. In the superior surface, we cannot see the quadrate, but we can see a small part of the caudate. But in the inferior surface, we can see all of the lobes, the smaller left lobe, the right bigger lobe, and the caudate and the quadrate part. The segments are made up of 1,000 small lobes or lobules. The lobules are connected to small ducts or tubes that connect with larger ducts to ultimately form the common hepatic duct. The common hepatic duct transports bile made by the liver cells to the gallbladder and the first part of the small intestine, the duodenum. Right here we are seeing the pictures, the right lobe having the posterior and the anterior part, and the left lobe having the medial and the lateral part. Here, the picture. And also, the other parts of the liver that also need and important. The coronary ligament or the coronal attaches the liver to the diaphragm and the right kidney and adrenal gland. The next one is the triangular ligament. Asymmetrically bilateral structures that help to hold liver in place. Right and left components covers left lobe and liver. The falciform ligament or the sickle shape anchors the liver, the anterior abdominal wall, and the diaphragm. The next one is the ligamentum teres or the hepatis, round ligament of a liver. a remnant of the left umbilical vein. The next one is the ligamentum venosum. A remnant of the ductus venosum occupies the fissures of the ligament venosum. Lastly, the lesser omentum, the L shape. This has two parts, the hepatogastric ligament and the hepatoduodenal ligament.
With the concept map and pathophysiology. So here are the risk factors, signs and symptoms, and diagnostic tests of the HCC. In here, we will be able to see what are the things contributed to this cancer. On the next slide, I will be presenting, which will be the pathophysiology. We will be able to see how to encounter this cancer, and I'll try my best to explain the idea of how a person will obtain liver cancer or HCC. So under here, we have the risk factors. We have liver cirrhosis, chronic hepatitis virus, alcohol consumption, obesity, diabetes mellitus, non-alcoholic fatty liver disease or NAFLD, and of course the gender male. Signs and symptoms, we have jaundice, unattended weight loss, fatigue, abdominal pain, nausea, and vomiting. For our diagnostic tests, we have alpha fetoprotein or AFP, blood test, ultrasound, MRI, CT scan, and liver function test. Now, under the pathophysio, we will see the types of hepatitis infections. So under here, we have the hepatocellular carcinoma, as we know as the most common type of primary liver cancer arising from the hepatocytes within the liver. As I've discussed earlier, the risk factors are in here. Blue colored legend, which is the risk factors. So firstly, to have this cancer, we have the risk factors. Yeah, as we know, our patient has diabetes mellitus type 2 and is alcoholic and a smoker. Combining those, if for how many years you have those hobbies or risk factors, this could lead into the cancer. Plus, the patient has all of this. So starting with this, we have the chronic infection with hepatitis B virus, hepatitis C, and cirrhosis are the major risk factors for HCC development. Now, this virus can lead to a persistent inflammation and liver cell damage. This promotes the progression to the cirrhosis and subsequent the development of the cancer. So, cirrhosis, to explain it further, it is a late stage liver disease which characterized by fibrosis and nodular regeneration. It is a significant risk factor for HCC, which can result from various causes that includes a chronic viral hepatitis, as we explained with Hep B and C, alcohol abuse, non-alcoholic fatty liver again, and autoimmune hepatitis. In having this infection, this slowly starts to transform into the cancer that we know, which is the hepatocellular carcinoma, which arises from the transformation from the normal liver cells into the cancerous cells. This transformation is often triggered by the chronic liver inflammation and the damage, which is under the Hep B virus, or under this second category, under them. Yes, with this damage, sometimes, well, it's not sometimes, which will lead into the tumor growth. It is the cancerous hepatocytes proliferate uncontrollably, which forms nodules or masses within the liver. The tumors may be single or multiple, or they can be multiplied. This will invade the surrounding liver tissues as they grow. So as the cancer grows and invades the tissues of our liver, the cancer cells can infiltrate nearby blood vessels, which includes the hepatic artery and portal vein. So which promotes further tumor progression and metastasis, which is while the contributing factors to complications such as the portal vein thrombosis, hepatic artery rupture, and dissemination of the cancer cells to the distant organs. To notice this, there are some signs and symptoms, which is the color violet, the legend colored violet, uh, that can be seen on the patient, and the most common is we have the abdominal pain, weight loss, and jaundice, which is again can be seen to our patient when we assess the patient. The increased pressure in the veins can make them swell, so they might be seen under the surface of our abdomen. Ascites can also develop when the liver isn't making enough blood protein or the albumin, which makes a swollen abdomen, which causes abdominal pain to the patient, which might be discomfort or a huge pain and a loss of appetite or feeling full quickly. So that is one of the signs and symptoms. So the patient SO stated that her husband drastically lost weight, making it one of the signs and symptoms of the cancer. As we know, our liver plays an important role in the digestive system, which cirrhosis and cancer in the liver can affect how much you eat and how much you lose. Weight loss is one of the signs and symptoms. Next is by having jaundice is the immediate findings of having problems with our liver. It might be noticeable for others since it is one of the common, and sometimes it can be dismissed by the individual itself or by the people at first, but it is a huge giveaway to know you have liver problems or disease such related to the liver. In other terms, bilirubin, it is a yellow pigment formed when our red blood cells in the body breaks down. In secondary liver cancer, bilirubin sometimes builds up in the blood because the cancer has blocked a bile duct or affected how the liver is working. The build-up of bilirubin in the blood is known as the jaundice, so which is why our patient has the skin color of yellowish in color, or also known as the yellow pigment. And thus, having these risk factors, you can notice something different happening to the body. This will immediately cause a liver failure, which is difficult to function or will halt the liver in doing their job on working on the body. Meaning the cancer that either begins in or spreading to our liver can cause our liver to fail or in a state of shock, which means overwhelming our liver. And it severely reduces the blood flow to the liver, causing liver failure. Another complication aside from the liver function is the hepatic encephalopathy. It is a decline in the brain function that occurs as a result of severe liver disease. And in this condition, your liver can't remove toxins from your blood cause, diba? It causes our liver to fail to function, thus causes a buildup of toxins in our bloodstream, which can sometimes lead to a brain damage. Lastly, under the complication, we have the portal hypertension. It is a elevated pressure in the portal venous system. The portal vein is a major vein that leads to the liver. The most common cause of the portal hypertension is cirrhosis or the scarring of the liver. So how do we determine if our patient has this cancer? Yes, we can see with the signs and symptoms by observing our patient with their hobbies such as hobbies of being an alcoholic, smoking, or the patient is diabetic. To know this, we have the diagnostic test of ultrasound, CT scan, and MRI. They work to see thoroughly and pour onto our body, specifically on this cancer, in which they can see if there is already started to spread on the liver. And yeah, so usually what are the typical management for this? We have the liver transplant, immunotherapy, and of course, the chemotherapy. Firstly, we have liver transplantation or the liver transplant. This offers the potential for long-term survival and cures for the patient with early HCC or liver cancer and underlying liver diseases. However, we need to be careful with the patient selection to be able to have a successful transplant. Usually, liver transplantation can be done with early stage of liver cancer. It is considered as a curative treatment option for the patient who is in the early stage of cancer. In order to have a liver transplantation, we have some criteria. Typically includes the size and numbers of the tumor, absence of vascular invasion, or extrahepatic spread, and the adequate liver function. So if our liver is still in the early stages of the liver cancer, we could try to do with the liver transplantation. The liver transplantation may also be indicated for patient with underlying liver cirrhosis, the scarring of the liver, or liver dysfunction secondary to chronic Hep B or C, and alcoholic liver disease, and of course the NAFLD or other liver conditions. Next is we have involvement the use of medication to kill cancer cells or slow their growth, which is the chemotherapy. However, chemotherapy is not typically the first-line treatment for liver cancer. It is often used in advanced stages of the diseases, which is different from the early stages of the liver cancer. In advanced stages of the disease, when surgery, liver transplantation, or local ablative therapies are not feasible, as we know that the primary goal of chemotherapy is to help shrink the tumors, or the slowing of their growth or spreading into the liver. It alleviates the symptoms and improve overall survival. Chemotherapy may be also used as a care to improve the quality life in the patient with advanced liver cancer. So lastly, we have the immunotherapy. So what is immunotherapy? It is a treatment uses a person's own immune system to fight off the cancer. Immunotherapy can boost or change how the immune system works. It can find and detect and helps attacks the cancer cells. Immunotherapy has emerged as a treatment approach for liver cancer as another alternative for instead of using chemotherapy or undergoing with the transplantation of a new liver. Immunotherapy helps harnessing the body's immune system to target and destroy the cancer cells. So yes, so these are the most common or mostly can be seen as one of the management for helping to cure with liver cancer. Okay, again, I am Rai, so I am back again under the drug study as one of my parts. So we have omeprazole. So as we know, omeprazole is used to treat a certain condition where there is too much acid in the stomach. It is used to treat gastric or ulcers and other gastro-related related acid, or GERD for short. It is a condition where the acid in the stomach washes up in the esophagus. So omeprazole helps with those things. It is not typically used as a as a direct treatment for the liver cancer. But however, in some cases, some individual with advanced HCC may experience complications such as the gastrointestinal bleeding due to the factors such as the esophageal varices or the gastric ulcers. In some situation, omeprazole may be helped or may be prescribed to help prevent prevent gastrointestinal bleeding by reducing the stomach acid secretion and promoting healing, which helps fight off the ulcer. Omeprazole may be also used in conjunction with other medication as parts of a comprehensive treatment regimen for individuals with the liver cancer who are undergoing chemotherapy and other systematic treatments. This is because certain chemotherapy drugs used in the treatment of liver cancer can cause gastrointestinal side effects, including the ulcer and gastritis. And omeprazole may help alleviate or lessen the symptoms and improve the tolerability of the treatment. So you may be confused why we have acid breakdown related drugs with our patient who is liver cancer. So overall, while omeprazole is not a primary or first treatment for hepatocellular carcinoma itself, it may be a supportive role in managing complications with side effects associated with advanced liver cancer. The indication for this, the generic name is omeprazole. So the generic name for omeprazole is omeprazole, and the brand name is Convamep. So the classification for this is the proton pump inhibitors. So the route is through IV, and with a frequency every 12 hours with a dosage of 40 milligram. It is used, yes, in the treatment or prevention of the stomach ulcer associated with non-steroidal anti-inflammatory drugs or NSAIDs. And omeprazole treats conditions by reducing the amount of acid on your stomach makes. So omeprazole is substituted with benzimidazole gastric anti-secretory agent and is also known as proton pump inhibitor, which helps blocks the final step in the gastric acid production by specific inhibition of adenosine triphosphatase enzyme system presents on the secretory surface of the gastric parietal cell, thereby suppressing gastric acid secretion. So, of course, we have some side effects. We have nausea, vomiting, diarrhea, constipation, flatulence, abdominal pain, headache, back pain, dizziness, and malaise. We have the drug-to-drug interaction. It may decrease the plasma concentration of niflinavir, rilpivirine, and atrazanavir. Increase of hypomagnesemia with diuretics may increase the plasma of concentration of saquiniers, tacrolimus, methotrexate, citalopram. So our food to drug interaction, the decreased plasma concentration, and avoiding of alcohol. Our nursing responsibility for this: firstly, we need to assess the vital signs before and after the administration of the drug, assess for hypersensitivity to any component of the drug, assess drugs that is already being taken for any drug interaction, and advise patient to avoid alcohol and foods that may cause an increase in gastrointestinal irritation. Then lastly, we have to instruct the patient to report any prolonged side effects, including the skin problems, rashes, and itching, or of course the GI effects. So moving on, we have the metoclopramide. So this is used to treat nausea and vomiting in patients with gastroesophageal reflux disease or diabetic gastroparesis. gastroparesis by increasing gastric motility. It is also used to control nausea and vomiting with chemotherapeutic patient. So metoclopramide is primarily used as antiemetic medication to alleviate nausea and vomiting, particularly in patients with ongoing chemotherapy for cancer. So as we know, chemotherapy um, uh, one of its side effects is vomiting and of course nausea. So with undergoing chemotherapy for cancer, this includes the liver cancer. So with our chemotherapy drugs, this is used to treat with our chemotherapy drugs used to treat liver cancer. It often has nausea and vomiting as side effects, and metoclopramide is one of the ways to help lessen these symptoms by blocking off the dopamine receptors in the chemoreceptor trigger zone of the brain. Thereby, this helps reduce nausea and promoting gastric emptying. Um, metoclopramide is like one of its function is yes, helps with being lessen uh, the nausea and help the patient not to vomit. So our brand name for metoclopramide is Reglan. The classification is antiemetics and prokinetics with the route of intravenous frequency of every 8 hours with a dosage of 10 milligram. So it is indicated for the above condition as well as for the prevention of vomiting that may follow emetogenic chemotherapy, as I said, or nausea and vomiting after surgery. It is also facilitates intubation of the small bowel and stimulates gastric emptying and barium flow in patients who require radiological examination for the stomach or small intestine. So the mechanism of action, metoclopramide is a substitute benzamide with prokinetic and antiemetic properties. It accelerates gastric emptying and intestinal transit time by stimulating the motility of the upper gastrointestinal tract and increasing gastric peristalsis without stimulating gastric or pancreatic secretions. So the side effects is we have diarrhea, nausea, tiredness, or weakness or lack of energy, rash, itching, and problems with the visions, our eyesight, drowsiness, dizziness, or involuntary muscle contractions. So food to drug interaction, or starting with drug to drug interaction, it is an additive effect with other neuroleptics on the occurrence of extrapyramidal disorder, may increase the risk of serotonin syndrome with serotonergic drug, and may decrease the bioavailability of the digoxin. Food to drug interaction, of course, avoiding alcohol. Alcohol potentiates the sedative effect of the metoclopramide, and avoid concomitant use. Take the drugs before a meal, before a meal. So co-administration with food decreases the bioavailability. Take 30 minutes before meals. So our patient teaching, our nursing responsibility, monitor for any reaction if and report if they occur. Instruct the patient to report involuntary movements of the face, eyes, or limbs, and severe depression or severe diarrhea. Then monitor the patient for dizziness, headaches, or nervousness after metoclopramide is stopped. This may indicate withdrawal. So we need to monitor all of those side effects that this drug has, and then tell the patient lastly to avoid activities that requires alertness for 2 hours after the doses. So that is all for my part under the drug study.
Drug study. Generic name tramadol, brand name Ultram, classifications opioid analgesic. Indication. Tramadol is approved for the management of moderate to severe pain in adults. Mechanisms of action. Tramadol is centrally acting analgesic that has opioid agonist properties. It binds to micro-opiate receptors in the CNS, resulting in inhibition of ascending pain pathways, thus altering the perception of and response to pain. Its inhibition of neural uptake of norepinephrine and enhancement of serotonin release may also contribute to its analgesic effect. Adverse or side effects: drowsiness, dizziness, headache, constipation, nausea, dry mouth, vomiting, indigestion, tiredness, itching, unusual sweating, and rashes. Route is intravenous, frequency every 6 hours RTC, dosage is 50 milligrams. Drug-to-drug interaction: increased risk of INR elevation and ecchymosis with coumarin derivatives, increase the risk of convulsions with SSRIs, serotonin or epinephrine reuptake inhibitors, anorectics, TCAs, antipsychotics, and other seizure threshold lowering agents. Food-to-drug interaction: avoid alcohol. Co-administration of alcohol may potentiate the CNS effects of tramadol. Nursing responsibility, patient teaching. Determines a patient's past or present history of addiction to or dependence on opioids. For better analgesic effect, give drugs before onset and of intense pain. Reassess level of pain at least 30 minutes after administration. Monitor vital signs and assess for orthostatic hypotension, signs of CNS depression. Instruct patient to increase fluid intake to prevent dry mouth and constipation. Generic name ceftriaxone, brand name Rosifin. Classification: cephalosporin antibiotics. And the indication is used to treat bacterial infections caused by susceptible organism in intra-abdominal infection and in many different parts of the body. Mechanisms of action: ceftriaxone is a third-generation broad-spectrum cephalosporin antibiotic. It binds to one or more penicillin-binding proteins, inhibiting the final transpeptidation step of peptidoglycan synthesis in the bacterial cell walls, leading to bacterial cell lysis and death. Adverse and side effects: black tarry stools, chest pain, chills, cough, fever, painful or difficult urination, shortness of breath, sore throat, sores, ulcers, or white spots on the lips or in the mouth, swollen glands, unusual bleeding or bruising, unusual tiredness or weakness. Route is intravenous, frequency now, dosage is 12 grams. Drug-to-drug interaction: may increase the risk of bleeding with vitamin K antagonists, may increase the nephrotoxicity of aminoglycosides, may diminish the therapeutic effects of BCG, typhoid vaccine, and sodium picosulfate. Food-to-drug interaction: no interactions found. Nursing responsibility: assess for allergic reaction, check the patency of the IV site and IV line, monitor hematologic electrolytes, renal and hepatic function, educate patient to avoid alcohol, and discontinue if hypersensitivity occurs.
So, good morning again. I am Emerine Jane Dalisco and I am going to discuss the nursing care plan. So, for the assessment, subjective cues: sakit iyang dibdib, tungod kay naay bukol sa iyang tiyan, as verbalized by the significant others. For the objective cues, received patient awake, lying on bed, and unable to move properly as observed. Not in distress, alert and coherent regarding time and place, with limited mobility, and initial vital signs were taken and recorded as follows. So, temperature 37.5, HR 95, RR 23, and BP 110/60, and also autosat is 99%. So, for the nursing diagnosis, impaired liver function related to substance misuse as evidenced by body malaise and bipedal edema. For the planning, short-term goal, within 12 hours of nursing intervention, the patient will first maintain homeostasis as evidenced by stable vital signs. And for the long-term goal, within 24 hours of intervention, the patient will first achieve overall healthcare optimizations, and the patient will have a plan for follow-up care and continued monitoring. Next is for the intervention with rationale. Emphasize the importance of responsible drinking or avoiding alcohol when indicated. This is to reduce the incidence of cirrhosis or severity of liver damage or failure. And then second is assist with medical treatment of underlying condition. This is to support organ function and minimize liver damage. And then third is encourage patient with liver dysfunction to avoid fatty foods, because fat interferes with normal function of liver cells and can cause additional damage and permanent scarring to liver cells when they can no longer regenerate. And fourth is encourage the patient to stop the smoking hobby, because the additives in cigarettes pose a challenge to the liver by reducing the liver's ability to eliminate toxins. And for the dependent nursing intervention, give medication as prescribed by the doctor to treat condition accordingly. And lastly is for the evaluation. Short term, after 12 hours of nursing intervention, the patient was able to meet the goals in nursing interventions. And for the long-term goal, after 24 hours of nursing intervention, the patient was able to verbalize understanding of individual risk factors that contribute to possibility of the damage, to possibility of liver damage or failure.
So for our NCP, the assessment, subjective cues, sakit akong ulo as verbalized by the patient. So our objective cues, restlessness and with facial grimace, kay sakit ang ulo. And also, initial vital signs were taken and recorded as follows. Yung heart rate is 95 beats per minute, RR 23 beats per minute, BP is 110/60 mmHg, and O2 sat is 99%. For the nursing diagnosis, impaired comfort related to headache. For planning, short-term goal, within 12 hours of nursing intervention, the patient's perception of altered comfort or pain will be decreased. And for our long-term goal, within 24 hours of nursing intervention, the patient will achieve overall healthcare optimization and able to verbalize relief of pain, and there will be diminished or absence of non-verbal indicators. So for our interventions, the independent intervention, monitor vital signs, note for location, scale, and onset of pain, use relaxation techniques such as deep breathing exercise, and lastly for our independent intervention, maintain calm and quiet environment. For our dependent, administer pain medication as ordered. Our rationale, independent establishes baseline data for review of existing condition to determine the nursing care to be given to the patient, to promote comfort and relaxation, and to minimize stimulus that could aggravate the condition of the patient. And for our dependent rationale, to help relieve the pain. For our evaluation short-term goal, after 12 hours of nursing intervention, the patient was able to meet the goals and nursing interventions. Patient verbalized being relieved of pain. For our long-term goal, after 24 hours of nursing intervention, the patient was able to achieve overall healthcare optimization, and there is no verbal indicators of pain or discomfort present. So that's all for our NCP number 4. I am Vince Carlo. So for our NCP, the assessment, subjective cues, sakit akong ulo as verbalized by the patient. So our objective cues, restlessness, and with facial grimace, kay sakit na yung ulo. And also, initial vital signs were taken and recorded as follows. Yung heart rate is 95 beats per minute, RR 23 beats per minute, ang BP is 110/60 mmHg, and O2 sat is 99%. For the nursing diagnosis, impaired comfort related to headache. For planning, short-term goal, within 12 hours of nursing intervention, the patient's perception of altered comfort or pain will be decreased. And for our long-term goal, within 24 hours of nursing intervention, the patient will achieve overall healthcare optimization and able to verbalize relief of pain, and there will be diminished or absence of non-verbal indicators. So for our interventions, the independent intervention, monitor vital signs, note for location, scale, and onset of pain, use relaxation techniques such as deep breathing exercise, and lastly, for our independent intervention, maintain calm and quiet environment. For our dependent, administer pain medication as ordered. Our rationale, independent establishes baseline data for review of existing condition to determine the nursing care to be given to the patient, to promote comfort and relaxation, and to minimize stimulus that could aggravate the condition of the patient. And for our dependent rationale, to help relieve the pain. For our evaluation short-term goal, after 12 hours of nursing intervention, the patient was able to meet the goals and nursing interventions. Patient verbalized being relieved of pain. For our long-term goal, after 24 hours of nursing intervention, the patient was able to achieve overall healthcare optimization, and there is no verbal indicators of pain or discomfort present. So that's all for our NCP number 4. I am Vince Carlo.
So for the nursing care plan number 4, so the assessment, so upon inspection, a patient are restless with facial grimace. With a lab results, iyang hemoglobin kay 51.0 and iyang hematocrit kay 0.15. So iyang hemoglobin o hematocrit kay below normal levels. So vital signs were taken and recorded as follows. Iyang temperature is 37.5, heart rate 95 beats per minute, respiratory rate 23 beats per minute, and iyang blood pressure is 110/60 with an O2 sat of 99. Nursing diagnosis kay ineffective tissue perfusion as evidenced by low level of hemoglobin and hematocrit. So for the planning sa short-term goals, within 8 hours of nursing intervention, the patient will verbalize understanding of risk factors or condition, therapy regimen, side effects of medications, and when to start contact healthcare worker. And for the long-term goal, within 24 hours of nursing intervention, the patient will demonstrate increased perfusion as evidenced by normal laboratory results, and demonstrates behaviors and lifestyle changes to improve circulation. For the interventions, for the independent intervention, so first is monitor vital signs. This is to establish baseline data and identify complications, and it is important to monitor oxygen saturation and pulse rate, because monitoring patients with oxygen saturation will help to detect any changes in the oxygenation patient. So advise the patient to take foods rich in iron and vitamins, so to support body's natural production of red blood cells and improve hemoglobin levels over time. So fourth is measure capillary refill. This is to determine adequacy of systemic circulation, and in cases of severe anemia or acute blood loss, a blood transfusion may be necessary. So this is to rapidly increase hemoglobin and hematocrit levels and improve tissue oxygenation. So for the dependent, administer iron supplements such as ferrous sulfate. So oral and parenteral iron supplements may be prescribed to replenish iron stores and stimulate red blood cell production. So for the evaluation, so for the short-term goal, after 12 hours of nursing interventions, the patient was able to verbalize understanding of risk factors or condition, therapy regimens, and when to contact healthcare worker. So for the long-term goal, after 24 hours of nursing intervention, the patient was able to demonstrate normal laboratory results and verbalize to engage in exercise like walking every day and avoids alcohol beverages and cigarette smoking, and also ita po siya mga healthy foods, healthy and nutritious